The Prime Minister has asked the Home Secretary and I to work on how we can remove NHS and care workers from the NHS surcharge as soon as possible. And I'm very pleased to be able to do that. I've already spoken to the Home Secretary and we'll be saying more on how we do this in the next few days. The Prime Minister has clearly himself been a beneficiary of carers from abroad, and we've talked many times during this crisis about the enormous contribution that people from overseas make to the NHS and to social care. So the purpose of the immigration health surcharge within the NHS is a fair one, and the purpose is to ensure that everybody contributes to the NHS, but also those who work within the NHS and within the social care are themselves making that contribution directly. So the Prime Minister has made that decision, and he's asked us to make it happen. We now have the results of our antibody surveillance study. This has told us that around 17% of people in London and around 5% or higher in the rest of the country have tested positive for coronavirus antibodies. This was based on a sample. But for the public at large to know whether or not they've had coronavirus, we need antibody tests at larger scale. 2 lab-based products produced by Roche Diagnostics and Abbott Labs have been given a positive evaluation by PHE and approved by the MHRA. And 3 further tests are being assessed right now. And I can announce today that we have signed contracts to supply in the coming months over 10 million tests from Roche and Abbott.